my name is Marinci. I'm a student physical therapist. I'm working under Dr. Clausen today. We have Veronica here in the clinic. We just finished up a therapeutic exercise, and we noticed with her post patellar fracture from 6 weeks ago that after the therapeutic exercise she has a little bit of swelling and pain and inflammation that we want to decrease, so we're going to do some cryotherapy. Some indications that would follow cryotherapy would be pain, edema, inflammation, and we want to prevent secondary hypoxia to the injured tissues. Contraindications for this would be any temperature or decreased temperature sensation, peripheral vascular disease, or Raynaud's disease, or if the patient can't feel temperature to that area. So first, we're going to look at the tissues and see if there's any abnormalities that we want to be aware of before we start cryotherapy, and we'll go through the whole procedure. So, hi Veronica, how are you feeling right now?
Painful, but fine.
A little pain. So what I'd like to do is put a cold pack on your knee to decrease some of that inflammation and kind of calm those tissues down after our therapeutic activities today. So it should help you feel a little bit better throughout the day. Since we are 6 weeks post fracture, we're end of the proliferation phase and beginning of the maturation phase, so we know that collagen is being laid down, so we want to encourage proper collagen formation. And with looking at her tissues, it doesn't look like there's any abnormalities that would contraindicate cold therapy, but it does look a little red and a little swollen. Do you mind if I touch your knee a little bit?
I'm good.
Tell me, can you feel this right here?
Yep.
And can you feel over here on this side?
Yep.
Can you kind of feel that my hands are a little cold maybe?
Yeah.
Okay, great. And even down here?
Mm-hmm.
Perfect. So I'm going to go get a cold pack and we're going to put it around your knee.
Okay, perfect.
So this should be a good size to just cover her whole knee, and then we'll put it in a pillowcase. And then I'm going to use this to secure it around your knee. Since your leg was immobilized in extension for so long, it feels comfortable laying here. Or would you like a pillow under your leg?
It's fine right here.
That's good. I'm going to wrap this around your knee.
Okay.
And I'm going to put this down. How does that feel?
Perfect.
Okay. So I'm going to set a timer for 15 minutes. And I'm going to give you a little bell. So here's the little bell. So if it starts to burn or you have any pain, I want you to ring that bell, or if we don't come right away, it starts to really hurt, I want you to take it off.
Okay.
And I'm going to set a timer for 15 minutes, 10-15 minutes, and then I'll check up on you and see how you're doing, okay?
Sounds good.
Perfect. Alright, so 10 minutes is up. I didn't hear you ring the bell, so I'm assuming it felt pretty good?
Yeah, it felt great.
Good. I'm going to take it off. Your knee might be a little cold, but let me just take a look. Can you feel my hand on the other side?
Yep.
Good. And so it does look like the redness and swelling kind of decreased a little bit. I don't see any abnormalities on the tissue, so I'd say that treatment went pretty well.
Yep.
So this cold pack therapy should be a really good thing to wrap up our therapy sessions when we're experiencing a little bit more pain and redness and swelling in that area. So
Sounds great.
great. Well, thank you.